Hi, I'm Rita, and we're on another episode of Mito Unshackled, and we're going to be unlocking Europe. So get ready, get your passport. We're going. Hallo, danke schön. We have amazing people here from all parts of the world of Europe, and a fellow American as well. That's based in San Francisco. We have Dr. Philic of Demacan. We have author over here, and then we have Dragan. And so before I get started, I just want you guys to kind of give you an intro of how you guys got started in this industry and what it means to you to be in this industry.
Sure.
Yeah, so I kick it off. My name is Philip. I joined Demacan 3 years ago, joining from the pharmaceutical industry actually. So running previously the largest business unit of American Europe, which was neurology. And since then I'm joined Demacan as a managing director, taking care of everything with the supply chain and purchasing, as well as marketing and sales.
Awesome.
Well, in that segue, I'm going to begin by saying I was country manager of your competitor, AstraZeneca, in Europe, one of the European countries. And Zeal is a company that is in the microbial control solution side of the business. Customers similar to Demacan we have in Europe. And for those German speakers, they'll recognize our company name Zeal means target in German. We target microbial pathogens.
First of all, thank you for having me. My name is Dragan Filovski. I'm Chief Expansion Officer for Onigrams. We are a legal hemp brand out of Germany, Berlin, and working to enter the American market. In New York with cannabis, and the rest is hemp.
Awesome. So, being in this industry, a lot of American brands that are doing very well here, want to get into Europe. And what are the hurdles that, the German market brings? And if you can kind of explain, Dr. Philip, like what the German market entails right now.
Yeah, so Germany is still a medical market, and we got to acknowledge that. And in Europe, it's not allowed, like in the US, to market pharmaceuticals. There's a strong prohibition to market pharmaceuticals, so it's a purely medical market. Yes, we have in Germany the so-called social clubs now, which are also allowed. These are small clubs which can grow themselves, but they do not market either, and you do have the home grow, but that's it about. We're discussing still in Germany about the so-called column 2, which is basically that we may have model regions like in Holland, like in Switzerland. Obviously, that may go along with having more opportunities for branding as well. But to that point right now, if it's just coming down to the pharmaceutical product, that cannot be marketed. Obviously, Demacan as a brand is right now well known in Germany already because we have been on all the national news because we had the only German grow basically in Germany, or the only German company with a grow in Germany. So we had lots of news companies coming by, and that obviously helps to build up your brand in Europe.
We're very excited about the opportunity to be in Europe. Both Philip and I come from the R&D pharma side of the business, and I'm going to speak to some of the parameters from a equipment supplier to a pharmaceutical market, and where it's a very differentiated market in Europe compared to the United States, where you're essentially building a pharmaceutical company in Europe, and so that brings with it a whole host of stricter regulatory compliance requirements, whether it's the GACP farming to the GMP processing, to the type of technologies you're using within your operation. So for us entering into the European market, coming from a North American perspective, where it's not a pharmaceutical market like what they're building in Europe, it's a whole different plan of attack to enter the market. More challenging, but one having coming from the pharmaceutical business, very much in our wheelhouse.
Thank you. For my standpoint here, we are only in the legal high market, not in the cannabis yet. We're working on this side as well, but our challenges entering over here, what I can speak of, is it's a total different game. So we start all over. We have to meet our future partners as manufacturing, as sourcing, as everything, distribution. So the same thing is for American brands to enter the European market, but it's just I say California, where I'm staying right now, it's about what Germany is right now, but 15 years ago. So that's with the collectives. We have the social clubs, like you mentioned. You know what I mean? We're in the same stage for now. So it's a great opportunity for American brands to enter the European space.
And maybe to add one more point to what you also said, I mean, we got to think about Europe as 27 different countries in the end, or 28 different countries. So every country has its own regulation, which makes it even a bit more tougher to get into different markets, because you need to acknowledge not only what GMP rules are there in general, but what regulatory rules apply for each single country. And they, I can tell you, are very different very often. So I think that makes it a bit more challenging. Even I know in the States, obviously, we have the different regulations from state by state, but still it's one country. And in Europe, yes, we have the European Union, but the countries have a bit more power in terms of how they outline the law, I would say.
And I guess another point for the American people, like we have different languages and different cultures on top of everything what you said, and this makes it on top very challenging to to deal with different.
Yeah, and going back to your point regarding culture, right? So when I was in Germany, I went to Mary Jane. I saw a lot of good culture there, but I also saw that like more of that corporate feel as well. So how do they balance that out in Europe, that corporate and that culture? Because it's very important here in the U.S. So how would a brand do that there if it's pharmaceutical grade in some aspects?
Well, as I said in the beginning, I mean, the company as such is a pharmaceutical company, and we had lots of people talking about Demacan, and that helps obviously building your trust in your brand and the company you have. As I said, I mean, it was previously working for Merck. It's like the oldest pharmaceutical company in the world, and that helps obviously to get patients to be very aligned on you to deliver them the best product. And we are very well regulated by the German authorities, so we are supervised and audited by the BfArM, by the national and regional authorities. So I think we have audits, more often than many other companies. So that helps obviously to build the trust into the brand and into the company.
And that's also why I think Germany is going to be the major player in this whole game, because the quality is just, the standards are just like Austria and Switzerland, where I grew up, or also Germany, are just different. And when you talk long term, that's going to be where I hope the best things will be produced and sold.
Again, from the North American perspective, I wish I could take many of my customers here in North America over to see the facilities in Europe, to see it's a step change in terms of the quality. If you go into a GMP facility, the clean rooms and the whole approach and the documentation. And again, from the perspective of an R&D pharma company, it's great to see that investment into the quality.
First of all, I mean, I just had a discussion previous to this panel here, where we were discussing, wouldn't it make sense maybe to bring a couple of maybe US or also Canadian players to Europe to come to our facilities? Okay, what are the requirements to work together? What do we need in terms of documents and so on and so forth? Because what we experience, and I have been traveling now for the last 2 weeks across Canada and the US, the understanding of what quality you need to adhere to and how processes should follow, hygiene standards, and all this kind of stuff are quite heterogeneous across the country. Let's put it that way. Second, I mean, R&D is important. It's essential to our roots. I mean, we're doing lots of R&D in terms of developing new products. So we are working on live rosin right now to have that EU GMP ready very, very soon. And the same applies for plant R&D. So we have our own diagnostic labs. We do tissue culture. So all the steps you need to do really to deliver a consistent and good quality product to the market, I think that is important to cover and to understand as well.
I'm going to add one more thing. So there was a discussion about GMP and the approach. GMP is a process. It's not a certificate or anything like that. It's a living process. You can augment, change it, add to it. It's dynamic, but the central tenets are repeatable, predictable, dependable, and the whole approach to quality testing in Europe is different than here. Here it's you have a batch, you send it out for testing, and it's just back and forth, back and forth, back and forth. And it's expensive. And Philip, maybe you can speak to this more closely, but generally it's you do the hard work up front, you validate your processes, and then you're left to run your business. Yes, there'll be audits along the way, but this rigorous, constant testing and oversight here in the United States is a little different approach. I'd be interested in your perspective of that approach in Europe compared to what you've seen in the United States in the last 2 weeks.
I would say, as I said, it's very heterogeneous here. I haven't seen too many facilities in the States because generally you cannot import from the States to Europe, so it's not of that high importance for us. But I can say for Canada at least, it really depends. So we have seen everything. I agree with you. I mean, you need to put the right foundation for your work, and then the output will be there naturally. And that's what we focus on, to see that we have strict and rigorous processes which are followed, SOPs obviously, and everything which is just GMP, which is stands for good manufacturing practices, and that's what we practice every day.
I can really not speak on this because we're buying generally and not producing ourselves. Of course, here it's a different story. We're gonna start with cannabis in New York, so we are already checking for everything and following the rules as much as you can with our partners. They have a micro license, so I'm definitely we're learning a lot. Also, this part and
Question. So if the US were to federally legalize cannabis, do you foresee Germany now partnering with US growers as opposed to the Canadian growers? What are your thoughts on,
I can take the question. So I would never exclude anything, and as I said, I have not seen many grows yet here in the US. If they adhere to the same quality standards, then obviously this would be a good business partner for us as well. But this needs to be a foundation, We need to audit them according to the rules. And if everything applies, then yes, of course, I would never exclude them. But that is just a requirement on how to approach business in order to be sure that we have a safe and good product for our patients.
I want to answer from the other perspective. If federal approval were to occur in the United States, would there be any incentive for American companies to go through the rigor of a GMP process? And the answer would be yes, if they believe their products have an export market to Germany or anywhere in Europe for that matter, it'll be a prerequisite. So for the Canadian companies, Canada went through a boom bust. The equivalent, just doing the quick calculation in US dollars and pounds, the domestic market, I don't even think it's as high anymore in Canada, is paying a wholesale $1,000 a pound, but they're getting 3x that price in Germany. So for the Canadian LPs, the market's in contraction up there. If your strategy is just domestic, you're barely hanging on. But so the export to the European markets, particularly Germany and the UK, have been a life raft for those Canadian LPs that went ahead and got GMP certification, enabling them to tap those export markets.
And maybe just for the US audience, to elaborate a bit more on GMP, I can say right now from the Canadian perspective, it's always the EU GMP. I know that Canada obviously has also GMP in their MRAs, which are mutual recognition agreements between countries in place, but they do not apply right now for cannabis. So you need to have a European authority come by and do the audit on you in order to have EU GMP, which is valid then in Europe. For other substances, for finished pharmaceutical products, it's a different stage and different approach. There, the MRAs are in place between Canada and Europe as well. But I can just say for Canada, and I suppose it's the same for the States, but please correct me, that you need the EU GMP. That's different, for example, than to Australia. With Australia, there is an MRA in place, so you can import finished pharmaceutical products as also for cannabis from Australia. That's not the case for Canada, for example, just as a point of clarification.
So what was it like, Dragan, to go back to you, being out here and experiencing like the different markets from Europe to here? Like, what would you say that a big difference you found from your perspective?
it's first what we talked about before. It's a culture. It's a culture thing. It's a big difference, and of course you have to get adjusted to the new system. It's not the same as talking taxes, talking sourcing, talking legalization generally, talking compliance. So you have to adjust from start all over, and try to work with the right partners and get into the market. We plan to already launch Champs in Vegas in February. So yeah, it's a lot to learn and a lot to do.
Nice. And just wondering, because I know you've been on tour, you said, for like 2 weeks here in the US. What was your biggest like difference in the market, like in terms of growing, here in Canada and Europe?
Well, as I said, I mean, we have seen many very different facilities. I think when I walk into a facility, I always get a very good impression, mostly of what product comes out of that facility. Do they adhere to the hygiene standards? If you have a room with powdery mildew, for example, you should not walk from that room to any other room because you will spread it across your whole facility. Not everyone understands it. I had facilities where people just walked it around and said, hey, Cal, first of all, why do you have powdery mildew in your facility? Second, why do you contribute it through your whole facility? Another example, pesticides. I mean, in Germany, in our facility, we do not apply any pesticides. We just use beneficials. And there are pesticides which are not allowed in the European Union, like sulfile. They're allowed in Canada. Well, then you need to check for that to see if the facility applies it. What does it mean in the end for the customer? Because there's mineral oil which is applied, obviously, until which stages is applied, and what's the regulatory framework for that? So I think there are many questions which come up when you tour around and see what quality really means, and also with regard to pharmaceutical product, which needs to be taken seriously.
Okay, so we're kind of short on here on time. Just to kind of close out this podcast, what advice would you give to young entrepreneurs that want to break into the industry, that are like maybe wanting to, just kind of like in this industry specifically? And, I know you guys come from like more of a pharmaceutical background, like what advice, because I know you're also a little bit different. It's a very general question, but just to kind of close it out. And also, where can people find you as well?
Yeah. So I think first, take quality seriously, because if you take quality seriously throughout the process, you will have a good final product. And that's the most important, the final product which does not harm any of your patients nor any of your buyers here in the US. No, you don't want to have any mold in your product when you release it to the people, because, I mean, especially immunosuppressed people, for example, they can really suffer any damage from that. So take quality serious, get into that, and be sure that it's followed up all the process, all the time, continuously, as you said. I think this is the very important part of that, to be doing the business right. And yeah, you can just reach out to me on LinkedIn. So just Philip Goebel on LinkedIn, search for me at Demacan, and then send me a message so I can respond to it.
Don't underestimate the investment, time and resources into meeting this must-have part of your business. There's no shortcuts, or else you'll find yourself out of business. Ziel.com, Ziel.com.
Yeah, for me, it's like do it, don't give up, and do it the right way, like the guys already said. From the beginning, try to do it right. You're gonna have a lot of hurdles, but at the end, it saves you time and headaches.
That was another episode of Meet and Shackled, and I'm Rita.